COVID-19 has changed the world. I'm interviewing extraordinary people on the front line, stepping up with amazing acts of kindness in the fight against this virus. Tune in to watch, support and share their inspiring stories, because together we are stronger.
Samantha, thank you so much for joining me today.
Very well.
Doing such an extremely important job, and what must be an emotionally challenging time. Do you want to tell me a little bit more about what you do and how it's changed in the light of COVID-19?
So I work in the funeral sector. So you've kind of got the NHS at the front line, and we're at the back line, and we're picking up the aftermath. It is it's a trying job at the best of times. It's very emotionally draining, but I wouldn't want ever to do anything else. I love my job. It's very, very rewarding, and the job satisfaction I get is just immense. I came into the funeral profession through my own personal losses. My mum tragically passed away in 2010 due to NHS negligence at a local hospital. So I kind of dealt with that, and then the following year I lost my son, and then in 2018 my stepson took his own life. So those experiences have built me into the person I am today. They've made me who I am, and they're my three guardian angels sitting on my shoulders, and they are my inspiration. They are my positive to the negative, and they keep me going, and they are why I do what I do. So I can provide families with the support that I received. And if I have one family have the gratitude towards me that I feel for the funeral directors who looked after my three angels, then that's a job well bloody done. But the last 3 to 4 weeks have been incredibly difficult with the whole COVID-19 outbreak. We have a lot of restrictions in place. We have local crematoriums who have restricted their number of mourners down to some are 4, some are 6.
And I know because of social distancing.
Yes. Yeah, it's heartbreaking when you walk into a crematorium and you've got single seats set out 2 meters apart, and a family that are in the same household have to sit 2 meters apart, and they can't comfort each other. I take a lot of pride in my work, and I'm a very cuddly person. I like to give hugs and cuddles to my families, and I can't even shake their hands at the moment. It's heartbreaking. I've done many services over the last few weeks that I've cried all the way home, because
I can feel your emotion. Just I know we're talking about a Zoom, but I can really feel your emotion. I mean, how are you dealing with it?
It's difficult. Obviously, there is, to my knowledge, currently there's no support out there for the funeral sector. I'm very, very proud to be in this profession. And nationwide, funeral directors up and down the country are working very, very long hours to ensure that they can provide everything they possibly can for families under the circumstances they're under. But in doing so, as part of our jobs, the emotion transcends from the family anyway. But in circumstances such as these, that emotional transcendence is huge. And we need some support.
Absolutely.
We need some emotional support. So if there's any services out there that can provide our funeral directors or funeral directors up and down the country any form of emotional support, it would simply be so helpful. Even if it's just a little bit of supervision, so that we can just let go. Because it's a lot of weight on our shoulders.
And compared to sort of before all of this happened, I mean, how does it compare to, say, a few weeks ago?
It's a complete other end of the scale. Completely the other end of the scale. We are so busy. Unfortunately, a lot of the loved ones that we have in our care currently are COVID positive. which is heartbreaking for the families. There are procedures in place that we have to follow. So whereas we would usually do last offices and we would dress the loved ones and we would let the family come and see them in the chapel of rest, if they're tested COVID positive, we can't do any of that. We're not allowed to touch them. The families can't visit them in the chapel. They can only visit if it's a closed casket. It's awful. I can't even put it into words. It's inexplicable, the hurt that you feel for the families, and especially when the families have been social distancing and self-isolating, so they haven't been able to see their parents or their loved one, and then that person passes away and they can't even say their final goodbyes. It's hard.
Oh my God, and what sort of volumes are we talking about? Say compared to this time last year, the volume's a lot higher at the moment of deaths.
Yeah, absolutely. They've just increased tenfold. You know, there's a lot of hospitals in the local area, a lot of funeral directors that are having to go to measures such as articulated mortuary facilities, pop-up mortuary facilities, because they just don't have the room in their on-base mortuary. You know, they're running out of space. It's I don't know how I could explain just how chaotic it is. It's awful. It's awful. You know, it's just this massive increase that nobody ever expected to happen. And, you know, we are struggling at times to keep up with the demand.
And how many hours are you working? I know we were actually scheduled to do this yesterday, and I know you were called in. How many people are you working long hours? You mentioned before that.
Yeah, some days I'm doing 12, 14-hour days, just to get everything in, to ensure that every family gets the same amount of attention from me that I would give to somebody else. So it's long hours, long days, but it doesn't, it's not a hardship as such. It's what we do. We are in this profession because we are passionate about this profession and we are passionate about what we do. So it's not testing so much, but they are long hours. It's very tiring. It's very tiresome. But it's all we can do at the moment. You know, a little acts of kindness go a long way.
And the memorial services that are actually taking place, are most of the people being cremated, am I right in saying, or is it?
Yeah, burials, it's very difficult with cemeteries. I mean, all of the crematoriums, I'm based in the West Midlands, so all of our crematoriums currently have security on the gates. So when we go to do a service, we have to be let in through the gate via security, and we have to prove obviously who we are and why we're there. Which when you pull up with a hearse, it's quite obvious.
Yeah.
You know, families are struggling because we can't offer limousines because of social distancing. So families are having to follow behind in their own cars. The cremations are very simple, they're very straightforward services, focusing more on the deceased's character and personality, whereas usually you'd go into a whole life story and you could spend in a service for 30-35 minutes talking about their whole life and their major milestones, and
celebration of life.
That's what it's all about. It's about celebrating life, and at the moment we're not celebrating life, we're grieving for that life, in more ways than one, in far many more ways than one.
And are the families able at a future date to come back and do is there any sort of, you know, if they're doing this, are they thinking that they can then, is there any way that in the future that they can come and sort of?
Absolutely. There's services known as celebration of life services. So where a loved one is cremated or buried, for example, and there is no immediate family available to see the funeral, a lot of people later on in the year will have a celebration of life service, which is a real good old knees up where
Mm.
we can talk about the loved one, we can tell the whole story and really truly celebrate their life. And the celebration of life services is becoming more and more popular now as well.
And I guess with all this happening, there'll be a lot in the next once all this craziness and lockdown finishes, then
Yes.
obviously
Yeah, there's going to be a big demand, I think. Once pubs and clubs reopen, there'll be a massive demand for the celebration of life services.
definitely. And in terms of how you talk to the families, I mean, you mentioned that you're a big hugger. I know hugs are so important. I'm a big hugger as well. How are you consoling or talking to the families? Presumably you have to stay at your distance as well. Are there any other procedures that you have to follow?
All we can do is speak to the families as we always have done. We speak to them with empathy, we speak to them with compassion. We are able to kind of put ourselves in their shoes in a way. And because we are, we have hearts, we feel their emotions. So that transcends then to the family. So the communication with the families is difficult, but we speak to the families no differently to how we would deal with a family under normal circumstances. But when you have to call a family member and tell them that their loved one has tested positive for COVID and therefore they're unable to come and view them in the chapel, that's hard. That's hard. There have been many phone calls we've made where we've come off and we've just broke down.
Oh, Samantha, it must be very, very difficult at the moment what you're going through and seeing this. I mean, are you seeing a lot of funerals that are taking place with no one there?
Yeah. I know Bradford and York crematoriums a couple of weeks ago moved to direct cremation, and we are just hoping that doesn't happen within the West Midlands, because regardless of whether there is 6 people in chapel, 4, 10, or 4, 5, 600, it makes no odds. We are still going to give that loved one a worthy and deserving farewell, because that's what they deserve. They weren't to blame for this whole situation. So regardless of the numbers, we will still ensure that we provide our absolute top-notch service to ensure that that's what their loved one receives.
Oh, that's amazing, Samantha. And how many people are allowed at the moment to a funeral?
It varies from crematorium to crematorium. One of our local crematoriums in Warwickshire is down to 4. Quite a few in the Birmingham area are down to 6, and there is one that has recently relaxed a little and gone from 6 up to 10. And we're hoping that in time, if people just follow the government guidelines, stay safe, stay home, that those numbers will begin to increase so that loved ones can say their farewells.
Yeah, when we're talking about the death toll, how much have you seen it increase in terms of obviously number of deaths that you're dealing with?
Tenfold. There's been a very, very big increase. Unfortunately, a lot, probably about 70 to 75% of those are COVID related and tested COVID positive. So it's increased tenfold. It really, really has. There's been a massive, massive demand. All funeral directors throughout the country are under a lot of strain at the moment and struggling and trying to keep up with demand.
And are you seeing sort of ages that are coming through? Is there a particular age range that you can see, or is it right across the board? Originally, we were told it was the elderly, the elderly that were passing away or that were contracting and then dying from COVID. But obviously figures have changed now. And
Yeah, it's all ages. Thankfully, we've had no children or young adults, but we have had quite a few middle-aged, from about middle-age right the way up to elderly. I recently did a service for a 51-year-old who was healthy, fit, healthy, came down with COVID, and 6 days later passed away.
6 days.
6 days, and that was heart-wrenching, absolutely heart-wrenching. He's left behind a wife, children, because of COVID. It's awful. I'm really struggling to kind of put it into words, the
Yeah.
impact that the COVID has had on families. It's hard.
I can, well, you know, what you're not saying, I think we can see, Samantha. Is there anything that you would like to say at this point in terms of what you think you would like to see changed?
I can't change the pandemic. I can't change the way that the country is with the lockdown and the restrictions and the guidelines. What I would like to see is some support out there. I know there's a lot of support for key workers, NHS staff, carers, etc. But as I said earlier, the NHS are on the front line, we're on the back line,
Yeah.
and there's no support out there, to my knowledge, for funeral directors and people working in the funeral sector. So it'd be really lovely to see some form of telephone or internet service available where we can go and offload and let everything go, because we are carrying so much emotional weight on our shoulders and receiving no support. So any form of support service would be immensely helpful.
Absolutely. Samantha, I'm coming to sort of my last question that I'll ask people. Do you think there are any lessons to be learned from this? If we're looking back in 3, 6 months, a year's time, is there any lessons that you think we can learn or take from this?
That's a tricky one. That's a hard one. I think lessons can always be learned. I think there are always lessons that can be learned from something. Currently, I am proud of what the funeral directors up and down the country are doing. I think we're doing all we can, but there'll always be something that we can do better. What that is currently, we're just doing everything we can. But I think once all this is over and we actually sit down and we can breathe and relax a little bit, I think that's when the mistakes will start to appear and we can go, okay, we could improve here, we can improve there, learn a lesson from here and there, etc. It's very difficult at the moment because our minds are just so focused on families. It's very hard to focus on anything else, really. I have a 13-year-old daughter at home who has severe complex needs, and having to quarantine for 12 weeks. So I'm always making sure that before I even walk through the front door, I sanitize my hands. I sanitize my hands as soon as I get through the door. I go up, I get changed, I get showered before I even touch my daughter. And I'm taking big risks going out to work every day, knowing that Ellie Mae has that condition and she is at home and I'm putting her at risk. But whilst my family is safe and well, I will continue to provide as much as I can to my families to make sure that their loved one gets the worthy and deserving farewell that they should be having.
Samantha, you're an amazing human being, and I just want to say thank you so much for doing everything that you're doing in this horrendous time. And thank you for taking the time to do the interview. I just want to say from my heart to yours, yeah, namaste, and thank you so much.
Bless you. Thank you so much.